as we deal with the COVID-19 pandemic. This chamber has partners all throughout the region, perhaps none stronger than Southwestern Vermont Medical Center, especially during this pandemic. And we want to continue to provide that information not only to our members, but to the community at large. And so we hope that you find these telecasts helpful, informative, and perhaps even giving just a little bit of hope as we manage through this pandemic. Joining me today, as they often do, Tom D., the president of Southwestern Vermont Medical Center, as well as Chief Medical Officer, Dr. Trey Dobson. Thank you, gentlemen, for hopping on the call again today.
Thanks for having us.
Absolutely. So let's just start off from where we last got together a couple weeks ago. How is the hospital doing in terms of morale, funding, handling both COVID cases as well as everything else that the hospital has to deal with day in and day out? And maybe we can start there and start with you, Tom.
Sure thing, Matt. Thanks again for having us here. Certainly, as I've said to many people, many groups, this has been almost our worst of times and best of times. It's hard to believe back, if you go back a little bit in time to March, when we were sitting down, certainly, Trey and our team, looking at what's going on. And it was looking, somewhat bleak at that point in time in terms of what we're faced with. The governor had to shut down through his executive order services throughout the state. We actually shut down about 60% of all of our services. And, it certainly impacted our volume and it impacted our revenue. And it forced us to do a lot of tough decisions, including having to furlough about 175 of our employees. But, and we worked diligently. I mean, again, I have to take my hat off to Dr. Dobson and the clinical teams. They stepped up and they worked around the clock, literally. And I'm glad to say right now, Matt, that we are open, ready, and safe. We have a situation here that we're back to our pre-COVID volume at the hospital. Many people stopped coming. Even people who needed healthcare stopped coming because they were afraid. And I just want people to be aware that we have a history at Southwestern Vermont Medical Center as being one of the safest institutions in the country. And we have won many national awards for this. And we took this challenge and we took extraordinary steps by our team to make sure that our healthcare system, all of our facilities, all of our services would be safe for our patients, visitors, and of course, our staff members. And, we did a lot of very innovative things here. I mean, Southwestern is a remarkably small institution that does things that really sets us apart. And, I think we were one of the first hospitals, I think we're the first hospital in the state that started to do drive-up testing for COVID, for the COVID test. We created virtual waiting spaces for patients who would come to our health system and they were able to stay in their car and be called in when their time of appointment was ready. We created a respiratory evaluation center, which is, I think, one of the first in the state for physicians to send their patients for COVID testing and evaluation. We're now doing 24-hour, 7-day-a-week COVID testing results. And again, no one else is doing these things. And we took this lead and many other hospitals in the state are following our lead. And another example is working with our major employers. And Mac Molding is a great example where their team of engineers worked with our team and came up with respiratory masks for our clinicians. And it made our staff feel safe. And we've all read these stories across the country of medical staff members being literally frightened to death in terms of being exposed to COVID. And we created masks for our staff that was, we gave out about 600 of those, and it was quite amazing. And Mac stepped up. So in reality, I think SVMC is one of the safest environments anywhere for people to go to. And our staff is trained. We have the PPE equipment. We created negative pressure rooms throughout our institution. We went from 10 to 42. And of course, we practice social distancing and we do all the necessary steps. So I think, all things considering, under Dr. Dobson's leadership and our other clinicians and many people, we have taken the lead, and I think we created an environment where people should feel as good as possible about their situation when they come here. So, and then we're also continuing to work with our partners, not only local partners, but in this case, Dartmouth-Hitchcock. And that's a picture of Dartmouth. And they've been, as you all know, we've been working with them for over 7 years, and we've done many things together, especially during COVID. We rolled out our joint telehealth program, and we were able to provide valuable services during the pandemic when people were unable to come to the hospital. And we're partnering with Dartmouth every day. One of the silver linings that we're seeing in this pandemic is that there is certainly a strong desire for clinicians and people to leave the metropolitan areas and come to a different place to live. And the country in rural Vermont kind of meets the bill for a lot of folks. And we've had our best recruiting season over the last 90 days that we've had since we've been here. And that's again been led by Dr. Dobson. But we've been able to recruit some terrific clinicians, and I think we're going to recruit more. Part of that is with Dartmouth's help in terms of finding these physicians. So
do you see that, and we've heard kind of whispers of it, as people are starting to look as Vermont as a top of the game in terms of just safety and health, and obviously COVID has pushed that to the forefront. I think we all believed it was that before COVID. Do you find that you're having more doctors and nurses interested in working in Vermont?
Absolutely. They are contacting us, and these are well-trained, well-experienced people. And again, I think it's something that we're hoping will continue, but I think it is, it's kind of being driven by COVID. To tell you the truth, our biggest problem right now, and you probably won't be surprised by this, is finding housing.
Yeah.
Housing is a real challenge, but we're going to work on that problem, and we're going to try to solve it. But so people are coming, and they want to come to work with us. They also want to come and be part of the Dartmouth team. So I think it's a great partnership that's going to forge some additional, I think, very talented people coming to the region. And also, I just want to mention that we're moving ahead with some major projects. The biggest one, and this relates very much to COVID-19 too, is we're updating our emergency room through an application to the Green Mountain Care Board, which is a state regulatory agency. And that's a rendering of our ED of the future, which is a doubling of our current footprints. And we treat about 25,000 patients a year. We're going to have a state-of-the-art emergency room, and hopefully we'll get final approval by the end of December. And we'll start construction of this project once the weather breaks in the spring. And in about 2 years, we will have a brand new emergency room that's going to double the footprints. And I think it'll be something that people will be very proud of, and we'll continue to provide the highest quality emergency room services.
And just recently, a pretty hefty gift towards that emergency room, which again, just another testimony to this community.
We've had many people support us, and we've had, as you just alluded to, Matt, a close friend of our health system who gave us a $2 million gift. And just last year, you remember too, the Kendall family from Mac Molding gave us a $5 million gift. So we have quietly been able to raise over $14 million towards this project. And we will go towards a public movement of capital campaign, but it's amazing the support that we've had from our community on the COVID-19 pandemic, as well as these key projects that are really all about the future of our area in terms of healthcare services. So this has been a very challenging time for us, but there has been some wonderful things that have happened, and we continue to work hard and be ready. And maybe I can ask Trey to talk about all the steps that he and the team are doing to make our community safe.
Yeah, and Trey, start with what day are we on? You always kind of let us know where we're at in this journey, and how is the staff doing on day?
Unbelievably, Matt, we are at pandemic day 238. That is measured from day 0 being March 11th. Of course, we started preparing at late February, early March when we knew this virus was coming. So now we've transitioned to just going by week. So we are at pandemic week 33. And at the end here, I hope that there's some time to talk about vaccination, because that's what's going to help end this pandemic. And we do have some updates on that for the community. So it'll be good to get to that point. As far as morale at the hospital, among the clinical and non-clinical staff, I believe it's strong. I believe the reason that it is strong is that we are very transparent. We communicate, we listen to everyone, and we have one priority, and that's to keep our staff and our patients safe. And we haven't veered from that. We actually say it each day before we begin our regular meetings for the day. So I do want to sort of go over, Matt, maybe some trends that we're seeing locally, because I know people are interested in that. We get a lot of news. And there's too many charts and graphs out there. They're beautiful on many websites, but you can drown yourself in them and they can lose their meaning. So let me just talk about that. I want to go into some testing here because we've made some great gains, as Tom was alluding to. And then I want to just go over some, what we should be doing over Thanksgiving and the winter as we await vaccination and how we can get through this safely. So I'll go on to, let me just see what that next slide is. For many of the viewers here, the slide may look familiar if you are going online and looking at the Vermont Department of Health website. I just want to put a plug in. They're doing an amazing job. They update this dashboard, daily, but they also improve the dashboard several times per month. They add new information to make it more useful. And then they just recently added, and I don't have the website link, but you can Google it. The Department of Health did an FAQs, which is a list of common questions that you may ask. They have a bot that you can actually type your question in and come up with some answers. And also there's travel questions too from other agencies that are really worth going through so you can better understand the complexities that are out there. And if we just look at this real quick, I just want to point out two things. The first is on the left-hand side, you will see all these numbers, and numbers are good. Graphs are good and charts are good, but numbers are good. And it tells you there are 27 new cases today in the state. There are 4 people hospitalized in the state. There are 4 people in the ICU. This is all good information for planning purposes. And then it shows the percent positive 7-day average. That's in about the middle of the page on the left. We want that to be below 5%. We really, ideally, is below 1%. Thank you for pointing that out. Below 1%, that means that we're testing enough. In other words, we're testing so many people that our positivity rate is low, and we want to be there. If you're above 5%, as you can imagine, that means that you're probably missing people out there who are positive and then contributing to community spread. And also just want to point out the graph at the top of the page there, or I guess I should say the upper half of the page. You can see on the x-axis time, we're looking back in March and April and those peaks, and then into May and the summer. But what we're seeing in October, we predicted. We knew this would happen. In July, we started saying that we expect late September, early October to see an increase in cases, and that's exactly what we're seeing. Now, the really good news is that bottom right graph, the deaths have not changed. And also, I don't have this graph, but hospitalizations remain really low. And there's several reasons for that. One of the prime reasons is that the vulnerable population in Vermont are doing a really good job of mitigation measures. In other words, they are socializing with their family in a distanced way. They are not taking risk. It also means that the younger folks that are actually catching the disease, and not many, but some, as you can see in that graph at the top, are not transmitting it to the more vulnerable population, which means they are doing good mitigation. Even though they may contract the virus from their day-to-day activities, they're not spreading it to the vulnerable population. We do expect that 1 to 4 weeks after Thanksgiving, these numbers are going to go up again, and we probably will see some increased hospitalizations. We believe that'll be a small increase, as compared to another state. And I'm going to use a comparison. I don't have this graph up. And that's South Dakota. And I want us to just think about South Dakota. It's a similar population with about 850,000. But let's remember the difficulties they are experiencing right now. They've had over 400 deaths to our 58. They currently, at this moment, have over 400 people hospitalized to our 4. So we feel for those healthcare workers out there, those essential workers, and then everyone that is having to deal with this situation, and know that we could be in that situation as well if we don't remain vigilant on all the mitigation measures. If we don't recognize that we're in a state of emergency and we need to keep at this, there is light at the end of the tunnel, and that's getting vaccination going. Once we get vaccination going, the pandemic will slow and then eventually stop and become a background disease. We know this is true because this is how all pandemics work. Of course, not all pandemics have we had a vaccine for, but they have eventually developed herd immunity. And herd immunity is not something we can achieve without vaccination for a very long time and a significant increase in the number of deaths. So fortunately, we're not going to have to deal with that. We're going to have vaccination this spring, and then by the end of the summer, it will be widespread.
Talk to me, Trey, if you will, just two questions. One, I think we've seen that come out recently, just now that other rural states, at a certain point we thought, well, it's just because Vermont's rural, right? Just because we're away from people. And then you start to realize we're surrounded by these mega urban centers. And yet you have these other rural states really starting to pick up in terms of their cases and deaths. What is Vermont doing? Is it something in our water, or is it something maybe we're practicing?
It's not in our water, which we probably don't want to revisit from a few years ago. It is in our behavior. There is some circumstantial. We do know the virus tends to migrate around the country, almost like a flock of birds or something moving around. However, it is in the behavior. And we know that our behavior has lessened somewhat, or our mitigation, and therefore we see increased cases. Now it is, I didn't show this either, but I think many people have seen maps of surrounding New England and New York, and you see that the numbers are increasing. So our numbers will increase as well. There's not some magic dust that exists at the border, but behavior drives this virus. And I'm just going to go ahead and jump into one aspect, Matt, and that is Thanksgiving. If we talk about Thanksgiving, everybody wants to see their family. Everybody wants to see some friends. They think, their family are good people. They're professional, behaved people, so they won't spread the virus, which we all know that's nonsense. Anyone can get the virus if you're in contact. And I think the governor and the health commissioner did a really good job last week of emphasizing the importance of understanding that you will spread the virus between family members. And in fact, in Vermont, it's a little different than South Dakota and some of those areas right now. In Vermont, the number one way we're spreading the virus is travel by family members, not people coming in to see the leaves and to come in and enjoy the outdoors. That is a source. But it's travel of Vermonters or families coming in to visit their loved ones in Vermont. They're spreading the virus that way. Fortunately, our behavior is such that we then don't go out to more moderate-sized events and spread it. That becomes community spread, and that's what you're seeing in the Midwest right now. So this graph that Ray just pulled up here, these are actually counts in our own health service areas. So that includes places like Hoosick Falls, of course, Bennington, Manchester, even a little bit down into Williamstown. These are all of the cases. You can see this graph somewhat mimics the one that I showed previously from the state, with higher numbers back in April, and then it lowering down in the summer and then creeping up a little bit. These are really low numbers. So the numbers of cases that we test about between 60 and 120 people a day, and we're coming up with numbers that are still very low, between 2 and 4 on a given day. And of course, that correlates with what I was talking about earlier on the percent positivity. Lots of days where we might test 100 people and get 0. At the bottom there are what are really important types of data, and that's to look back at the last 30 days, then the last 2 weeks, and the last 7 days. And those numbers are intentional. They're not just made up. They have to do with the incubation period of the virus and then the transmissivity. So you've heard of those. So if we look at the past 30 days, we've only had about 1 case every other day. So we're holding our own here. We're increasing very slightly. And I believe it's all due to behavior. Unfortunately, after Thanksgiving, we're going to see an increase because people are going to be coming in to visit with their family, or they're going to be leaving the area and probably not quarantining appropriately when they return.
It's something you're very good at, Dr. Dobson. And just to reiterate to the people watching, in a way, and not that we're all going to get COVID, but we'll all get a vaccine, or we'll all be in contact at some point or another. And one case here and there, and even a couple cases here and there, are not something to kind of, go to the bank on, or to say what a failure on the part of, 2 weeks ago it was Central Vermont. Then it, comes down to Bennington, Vermont. Then it gets up. Talk to us a little bit about the myth, or just even, I guess, perception of COVID, and how we have to, we're kind of isolated here in Vermont. We have a pretty good track record. So when we see something pop up, we get kind of nervous.
Right. Well, there's you actually hit on something, Matt, I really want to talk about, and that's a key way that we can prevent the cases from turning into outbreaks. Let me just start with this slide by saying, the good news is in the first half of this pandemic, all the way through June, and into July, we were relying on information of experts and studies done in lab, and that's good. That's the best information we've had, that we had at the time. But now everything we're doing from July on is based on actual experience in Asia, Europe, and the United States. So it's no more guesswork. You're not going to see guidelines change much. They may evolve with some improvements, but we're not going to see those wild swings in recommendations from the federal government, or from our state government, or even our local experts, because we're using actual experience. And if we go to that actual experience, we know that in areas that practice good mitigation, like Vermont, and remember the mitigation, there's 5 measures there. It's hand washing, it's wearing a mask, it's distancing, it's screening and testing, and then importantly, it's having a culture in our society that supports those 4 things from occurring. It supports them to occur. So with those mitigation measures, we're still going to have people that get the virus, people that have done everything they can, but somehow they come across the virus and they get it. However, it prevents those individual cases, as you were saying, Matt, from becoming clusters. In other words, groups of 4 or 5 people. And those do happen in families, because in our homes is where we're not wearing masks and we're not distancing, and that's okay, that's expected. So we get these clusters. In fact, in our area, 80% of the cases we see are spread through family members, which is really remarkable. It's actually a good thing, because it's not going from one family to another family. That's an outbreak when you start getting multiple families involved. Now, there have been a few, of course, and as you mentioned, in Central Vermont, that was a large outbreak affecting nearly 100 folks. But if we continue with our mitigation, we're going to have a few people that get the disease. Hopefully, they're going to be healthy. If they need to be hospitalized, we can certainly take care of them. Their family might get the disease, and then that's a cluster, and we can help with that. But what we want to prevent is that next step: dinner parties, weddings, large Thanksgiving gatherings from turning into outbreaks. And once it gets into an outbreak, it starts to spread. Members of the family go visit others. They go to an event. And that's what happened in Central Vermont. And we were fortunate to be able to contain that one. And if people aren't familiar with that, they can look that up. But that was a small number of people from a hockey match that just turned into nearly 100 folks around the state getting the virus.
You had mentioned vaccine a while ago, and we keep kind of mentioning it. I'm sure it's got to be on the minds of everybody watching. Where are we at with that? What, from your perspective as a trained doctor and being around some of the best doctors in the Northeast, what's reality? When are we getting a vaccine?
Sure. So that's a great question. We've learned a lot in the last 2 weeks, Matt, on this subject. Let me just start by saying it's been the FDA has been very clear, and it's been backed by scientists, that we're pulling this out of the political discussion, and that safety and efficacy, in other words, how safe is it for patients, and then how well does it work, are the most important priorities. It's not timing. So we feel good about how the trials are going. In fact, the trials have been going as well as we could have hoped. In fact, better than I had hoped or imagined back in June when we discussed this, Matt. So safe, it's been safe. The efficacy data is not out yet, but we believe it's greater than 50% for several of the vaccine candidates. 50% is the threshold for whether or not the FDA will release it. So we are on target to start receiving vaccine in late November or early December. It's going to be phased approach. And the way it's going to work is phase one, our healthcare workers. And that's sort of a broad definition that includes doctors, nurses, frontline staff, ambulance, EMT, and others. That'll be done through the hospital system. The second phase will be essential workers that are also considered frontline, teachers, police, fire. And then the third phase will move towards vulnerable populations, people over 65, people with comorbidities. And then the fourth phase will be the general public. And right now, it's been moving much more smooth and much more effective than was feared. And if it continues in that way, we're going to see mass vaccination occurring in the late spring. In other words, opening up to phase 4 in the late spring and early summer. So that'll be fantastic. I want to make one more comment, Matt, because this is something that is a misconception I'm starting to hear. I'm hearing people say, well, if it comes out and it's only 65% efficacious, then I'm going to wait for the next one. And that's actually the wrong approach, because if all of us got vaccinated with a 65% efficacious vaccine, the virus would go away. We'd be at herd immunity really quickly. It would be just a very few amount of the virus in the background, even at 65%. If only a few of us get the vaccine at 65%, it'll continue to spread at rates, approaching what we're seeing today without vaccine. So I want to encourage people that just because something's not 90% or 100% doesn't mean it doesn't work. In fact, the more people that get it, the better, and the less chance it'll spread.
I know you've got more slides, Dr. Dobson. I want to bring maybe Tom into some of this. One of the things that got us all together again was really, getting over fall foliage. We know November 1st is when we all start in Vermont, start to hunker down and get ready for the winter months. What are you seeing in terms of flu vaccinations? We talked a little bit about that before, but I think you all have had some open clinics since then. So flu vaccines, do you even find that if we all kind of do what we're supposed to be doing here in Vermont in terms of washing hands and face masks, does that limit flu and other things within the winter? Are we going to find that we're in one of the healthiest winters if we all pay attention and do our job? Where are we at in terms of preparing for winter?
I'll start just by saying real quick, and then Tom can there. You're right, Matt. We may very well have one of the healthier winters as far as upper respiratory tract infections, including influenza and other viruses. That is, if people continue to do these, and if people do get vaccinated for flu. So we have had several drive-up flu clinics, which has been a big success. People can still get the vaccine, of course, from their doctor and also from pharmacies. And at this point, what we care about is people getting the vaccine. Don't care where you get it from, just get it, and we'll help you get it if you're having any troubles.
And Trey, the number of people who have confirmed cases of the flu seems to be pretty small.
Well, right now it's 0 in our
area. Yeah, and nationwide it's a very small number, Matt. So this may be again, could be a silver lining in this whole case.
Yeah, and do you? What else are we? What else are we seeing in terms of? I think of also as schools start up, that usually tends to be a pretty big hot spot in general for kids bringing that back home. What are we seeing there?
Well, as far as COVID, we are fortunately seeing very little transmission at school. The positive cases, for the most part, have been transmission that's occurred in the community outside of school. Now, there have been a few cases in Vermont, up in Montpelier, with some spread. With the younger kids, it's hard. They need some touching, they need some hand holding. It's harder for them to distance, and that's where we see it. As far as high schools go and boarding schools really around the country, it's just a great success that there has been little transmission at schools between students and between teachers, which is great for keeping our schools open. We're pulling up a slide here to show that we do know, and I think all of the viewers and listeners are well aware now, that the prime spread of this virus is through respiratory droplets, and then the second way it's spreading is through aerosolized droplets. And the difference there are just the size of the particles. No one's shaking hands. Everyone's washing their hands, so it's not spreading through contact except in families. And it's spreading through people coughing, but also speaking and being in indoor areas where the ventilation is poor. And so some examples of that really are if you are eating in an auditorium or in a place that has poor ventilation, you don't have a mask on, we're seeing the virus can spread greater than 6 feet, up to 10, 15 feet through these small aerosolized particles. The good news is these particles are extremely vulnerable to just slight air exchange. So opening a window is sufficient to limit the virus spread significantly. And this is just, a rendition from the World Health Organization saying, look, open a window and it just helps tremendously. If you don't have a window, do have ventilation, and most modern buildings do, that bring the air out and not recirculate it. That's HVAC systems. So very important.
I was going to say, we were on a lodging call earlier today, and I think some of the hoteliers are trying to, do various things, portable air cleaners. I'm sure there's everything on the market. What are some, are they truly innovative in the sense that they help? But what are you seeing that's coming on the market in the last 7 months that either helps, doesn't help, but is good in other circumstances? What are you seeing?
Right. So, well, the first is not really on the market, but there's more data showing that opening a window 6 inches is sufficient.
Not on the market, but everybody can do it for free.
That's right. But it may not be everywhere. I know in my office I can't open the window. There are places that you just can't do it, and so you have to look at other things. Most buildings actually do have an air circulation that is sufficient. The problem is how do you know that? And we know that in school systems, some of the schools are older and they needed an upgrade. So there are these aftermarket filters that you can buy. Most of them actually work as advertised and are not that expensive. What you look for is a HEPA filter. And the prime thing you would like to look for is something that actually takes the air out of the room through a window or another outlet, much as an air conditioner would do. Now, I'm not talking about an air conditioner, but I'm saying how you need that outlet that takes the air out of the room. I think that we brought this slide up just to kind of summarize many things here. It shows that what we're seeing is if you put in place all of these mitigation measures, we don't spread the virus. And that's why Vermont, that's the behavior. That's why we're doing well. But in some places that don't take it very serious, where you have people not wearing masks or not distancing, the virus spreads. And it really does take all of society working together, or else the virus will spread. And we know that that's what's happening in the Midwest and in other areas.
Matt, I just want to add that Trey and our clinical team have been going out to many organizations and schools, firms in the region, consulting with them, providing advice, helping to deal with the common day questions. And there are many questions that come up, and I think it's been a terrific partnership that we've been able to form to help to have businesses and schools not to overreact, because certainly shutting down businesses isn't good for anyone. Shutting down schools doesn't help long term. So it's been a terrific partnership that we do in trying to assist the community.
Yeah, and I would echo that, Tom. Trey has been, and your whole staff really, but I know we've connected Dr. Dobson with a couple of our members and businesses that really just had some concerns. So kind of the availability has just been terrific. I want to pivot a little bit to two topics that we want to talk about. One's a comment on Facebook that, Tom, I want you to kind of answer, and then I'll lead into the next one just to give you some time to think, but around, as we start to get back to some semblance of normal, I know there still are some crises here in southwestern Vermont, one of those being opioid abuse. And so I want to talk a little bit about the further developments and efforts of the hospital to focus on that. But first, let's go to Tina Cook on Facebook. She asks, this is in relation to, we see new doctors moving to the area. Are you actively seeking more clinicians of color, seeing as COVID has affected New Englanders of color disproportionately?
Yeah, we are, Matt. We actually have put together a whole diversity committee and putting together an effort in terms of the health system as well as reaching out to the community. It is challenging because it's challenging to recruit people to Northern New England, period. But it's something that we're taking seriously, and we're trying to see, what can we do to enhance and make our opportunities here more attractive. And we have a very broad-based group of people working on this throughout all parts of the organization, all backgrounds, ethnicity, and we're trying to come up with ways of how we can be more attractive, and we think over time we'll be successful, but it's not a problem that we'll fix overnight. But I think with a lot of diligence, we can get there and be better.
Great. Matt, let me just say from the recruiting standpoint, without diversity, we can't innovate, and without innovation, we can't improve outcomes. Diversity is incredibly important. That includes ethnicity, people of color, includes regions that we recruit from, includes backgrounds that can add. And we're having one of the largest recruiting years, as Tom was talking about, and we do have people that are meeting some of our criteria. We're looking out for them especially, and I think you will see that. When we recruit someone, it takes about 6 to 8 months for them to get here. So it's going to be the summertime before people start seeing some of those efforts come together.
Great. Two more community questions. One on where we're at with the opioid crisis. Has that become dormant because of COVID? Has it increased because of the stress level? And then the hospital's kind of cross-functional effort with a lot of partners throughout the community. And then, Tom, you had touched upon housing. Maybe as we finish up, how do we solve this housing crisis? We do, even at the chamber, see a lot more people interested in Southern Vermont, and one of the biggest things we hear is we just can't find the right housing. So first, let's tackle the opioid question. And how are we doing
I'll
there?
have Trey talk with the clinical. Well, let me just say, from the standpoint of planning, we are very active with our opioid community group, led by Christy Cross, who works for us. We meet on a regular basis. We're developing a number of initiatives. The health system actually is developing a plan in terms of looking at the options of creating a hub and spoke system, which would be treatment of higher acuity opioid patients, as well as having a system of support through our medical community. That's the spoke, and the hub would be a system at the hospital. It's expensive. It's a lot of regulatory burdens, hurdles to overcome, but we're working aggressively on it. It's become a little more acute, especially with the recent closure of the Brattleboro Retreat facility, their program there. It's not a lot of patients from our areas go over there, but we do have some, and we think we should have a service in our local community. So we're actually putting together a business plan that would hopefully address that problem. Maybe Trey can talk about the clinical aspects of it. And, given what's going on here, the problem is not abating, unfortunately.
Yeah, it's not. Unfortunately, it's there are some data from national and in Vermont you may have seen suggesting that maybe increasing. I anecdotally hope that not to be the case. I believe it's sort of flat. In other words, the positives effects from COVID and the negative effects have kind of canceled each other out. We do work with many partners, and all partners are equal and add value. From an emergency room perspective, where I practice closely, I can just tell you Turning Point has made a big difference. They are a super organization, and they make a real change at the ground level for these individuals. But we need to do much more. We need to look at having some type of local medical detox facility. We don't have that, and that is very problematic for the patients, their families, and the community. So we'll be looking at that in 2021 and 2022, and continuing work with across the whole county and health service area with the many partners that you mentioned.
Great. Housing, and I just want to let our audience know we will answer questions if you post them. We're watching Facebook, so if you do have questions for Tom or Dr. Dobson in the last couple minutes of the telecast, we're happy to ask them. I have two more questions around housing and the Putnam project, but first let's go talk about housing for a little bit. Tom, what are you running into, but also what has the hospital done in the past couple of years, and what do you plan to do in the future in terms of housing deficit?
Yeah, well, I would say, Matt, right now the housing situation is now getting to a tipping point as a crisis. Very difficult to find the housing. I mean, over the last couple of years, we started a smaller program. You may have heard about the Healthy Homes, where we bought distressed homes to convert them, and we're still doing that. So we had to put a hold during COVID, so we haven't really reactivated it yet, but we will. And our goal is to buy some homes that are really in distress and to renovate them and to sell them back to our workforce. And I think that's been a well-received program, but it's a smaller program. We're trying to deal with a bigger program, partly through the Putnam project, where we're going to have ultimately, when we're done, I think it'd be close to 60 plus apartments downtown. The first phase of the Putnam project has 32, and those are all close to being fully pre-leased with a waiting list. So we know the demand is there. We're now, as a health system, looking at developing a plan to create workforce housing. And we'll be coming out with more information on that probably within the next 30 to 60 days in terms of some thoughts and development side. But we know we can't be successful if we can't come up with a housing strategy. And so we think that can be a win-win both for our health system and for our community if we do it the right way. And it's going to be a pretty high priority.
Great. Question coming through on Facebook. This may be more for you, Dr. Dobson. Have you heard what the side effects of these vaccines are, long-term effects? Being that these are so new, I feel people would be nervous to get it since we don't have long-term effects data.
Yes, and I'm also going to jump into the housing real quick before I answer it. If anyone out there has a part of their home that they would be willing to have a professional or healthcare worker stay in while they're trying to get settled, that will help. To the person earlier who asked about recruiting, it's not only a barrier, it's a barrier to them actually signing and coming here, because if they can't find a place, they can't come. So the vaccines, let me just say, in general, vaccines are actually historically extremely safe if you look at them in comparison to all different types of drug trials. You know, drugs and vaccines are serious things we have to study, but the way a vaccine works is a fairly benign, safe instrument, especially in comparison to some of the more potent drugs that we think about for cancer treatment, heart disease, and other things. So they're going better than expected in that sense. Generally, when you do a drug trial, because there's large numbers of people, 30,000 in an arm, someone has an event that can't be explained, then you have to first see, was that person actually on a placebo, or they actually on the vaccine itself? And so far, I think people are aware, we have over 10 vaccines that are in phase 3 trials, which means they're being tested in hundreds of thousands of people. And the safety is about like expected, which is extremely safe. As far as efficacy, we know that if they've made it to this level, they do have greater than 50% effectiveness, but we won't know the exact number until probably in the early spring. So we'll actually say if they're greater than 50%, emergency use authorization will allow them to move forward, but we won't have that next number until we get a large population. And the reason is because that large population has to be exposed to the virus, and we have to show they didn't get the virus, and that takes time.
Okay. Just scanning over Facebook, if anybody has any final questions for Tom Dee, President of Southwestern Vermont Medical Center, or Dr. Trey Dobson, Chief Medical Officer. We'll give you about another minute. Any final words of wisdom as we head into the winter? I guess I'll have another question, and this may be to our business owners, especially I think of the ones that are going to have to change so much from a relatively nice summer, which would be our retailers and restaurant owners, to I'm sure many of them are going back into winter survival mode. What, if anything, Trey and Tom, can you provide them? How severe are they going to have to close down? Dr. Dobson, you and I have talked about the lack of ventilation in a lot of restaurants already, and then the idea that you're going to open up a window when it's 10 below, probably not going to happen. What can you provide us for those dining and retailers?
Right, it is tough, Matt. I've had people actually come up and become angry with me, and I'm just telling people like it is. It is tough. So you have to be innovative. We have to be innovative together. If that means opening windows and cracking windows in a restaurant, but having blankets available for people to put on, it's really important. We talk about a risk assessment, as Ray just threw up on the screen here, put up this slide, and we know that there's high risk activities and low risk. And the very first one mentioned up there are indoor activities. That includes, eating at a restaurant. So I will eat at a restaurant indoors, but I will choose the restaurant that I know the ventilation is strong, and I will minimize my time there. I will not order appetizers. I will not use it as a time to visit with friends. I will do that in another way. I also want to make sure that I'm going to the restaurants and getting takeout and supporting them. I think people have tried to do that, and let's continue to do that. And then let's look, there is an end. It's not an extreme, walled end that'll happen magically in the spring, but it will be to the point where in this late spring and summer, and then certainly into the fall of next year, a majority of people are going to be able to participate in these activities in a safe way. So let's help them get through this winter and be innovative in how we do it.
New question on Facebook. Any antibody testing locally?
Yes, we do antibody testing locally. It's a little bit discouraged, and I'm going to try to explain why. The reason is the incidence of the disease, believe it or not, is still so low. The prevalence is so low that the antibody test is not reliable. So your chances of having a false positive are very similar to the chances that you actually had the virus. You have to go to areas like New York City that have had a positivity rate greater than 20% before the antibody tests start making a difference.
Great. In wrapping up, just again, as we head into the winter, give us some winter tips, safety, travel tips, holidays. We're all, heading that way with Thanksgiving and Christmas and some of the Jewish holidays, and then on into New Year's. What can you tell us? What are Dr. Dobson's top 5 or 10?
Well, the first one I'm going to deliver is not going to be easily received, but we're in a pandemic. We're in a state of emergency. it's not the year to visit extended family from outside the area, and it's tough. And I know people still are going to want to do it, and they're going to say, but I have someone who's very ill and I need to go see them, then that's okay, and quarantine afterwards. But this is the year, I know personally, my family, we're not visiting. It's hard. We're going to visit when the pandemic is over. We want to keep our community safe. I want to keep my patients safe. I want to keep my colleagues safe. So I think a majority of us can take this year and say, we're going to sacrifice this time and not go visit. It's hard. The second things is just to stick with these mitigation. You know, you have to have good mental well-being. You have to get outdoors and exercise, and you can socialize, but using the same things we've talked about since, you know, back in April, and that is keeping the distance, or I should say really in June, keeping the distance, wearing the masks, get out on walks together. If you do socialize indoors, keep the time short, wear masks, and don't use it as a time to eat together in large groups of people. It just, unfortunately, that's how the virus spreads.
You know, Matt, we are also, unfortunately, still making tough decisions for the health and safety of our staff and patients. And you just probably saw recently, we made decisions about restricting visitation to the health system. We don't take those things lightly. I mean, I personally take it very hard because I know how important visitation is, but we are trying to keep our staff, patients, and visitors safe. So we reevaluate this on a regular basis, and we'll continue to do that. But I think why we've been so safe is that we've taken these steps, and you know, we work together to try to, you know, get through this, and we will get through this. And this time next year, I think things will be much better. But let's keep the faith, and let's try to, you know, keep together on this and stay as a team.
Great. Good place to end. And I want to thank both Tom D. of the hospital as well as Dr. Dobson for joining us again. Gentlemen, you know, let's get back together, maybe just digitally, when some new news comes out. And we want to thank you on behalf of the community for all the hard work. Please send our thanks to the staff members, everybody at the hospital who has been on the front line now for many, many months. And if we don't see you before then, happy holidays.
Great. Thank you.
Matt, thanks for what you're doing. Take care.
Take care.
Thank you all.